Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. We welcome back today Tami Burdick. She's a patient advocate. She's the author of the book, Diagnosis Detective, Curing Granulomatous Mastitis. And today's KevinMD article is Women's Intuition in Health and Healing. Tami, welcome back to the show.
Thanks so much for having me back again. I appreciate it.
So Tammy's been on multiple times giving a perspective from the perspective of a patient advocate. Go to kevinmd.com/podcast to search for her name, her story, and her prior episodes. Her most recent article is titled Women's Intuition in Health and Healing. Now, Tami, for those who didn't get a chance to read your article, just tell us what this one's about.
Yeah, so it really emphasizes a specific women's health issue known as endometriosis, but it also kind of correlates with the difficulty in getting that diagnosis. So oftentimes women are really having to go with their intuition and kind of fighting or advocating for their health when it comes to this disease in general.
All right. So, for those who aren't familiar with that condition, tell us a little bit about endometriosis.
Yeah, so endometriosis can affect 1 in 10 women typically. And it is a chronic inflammatory disease, basically, of not only the reproductive tract of the female, however, it can also really affect the entire abdomen. So sometimes women will get these lesions, for say, all over the different organs throughout their abdominal cavity. Oftentimes, you'll see endometrial tissue that's supposed to kind of stay isolated to the uterus start growing outside of the uterus, and these lesions end up in the abdominal cavity of women. And then oftentimes, they'll have a variety of symptoms, painful periods, where their menstrual cycles might be longer, they might be more frequent throughout the month. You might also have significant pain, and not only during your menstrual cycle, but other times throughout the month of through the month as well, such as ovulation in particular. So oftentimes women will go to doctors and they're like, I've got these horrible menstrual cycles, yada, yada. And they're kind of overlooked, or some of them might even call it medically gaslit. And it can take years to get a diagnosis of the condition.
So, tell us some stories, it could be from your fellow patient advocates, about how endometriosis may be overlooked in the exam room. What are some examples of that?
Yeah, so I actually have endometriosis and I wasn't diagnosed until I think 2021. Honestly, I had no idea that I had it. Luckily, I had a new gynecologist that I went to who wanted to be the one that would initiate some testing just to kind of see what possibly could be going on when I was describing my menstrual cycles to her. Because heavy, painful periods is actually not considered normal. But unfortunately, many doctors make the patient think that it's normal. So there's been a lot of women who have gone to their doctor with all of these symptoms and it just gets overlooked. And they might go years and years and years of the same complaints. And deep down inside, they know like something is not right, like something is completely going on
Mm.
here. And they kind of go through this, vicious cycle similar to what I did. But there's a lot of women in some support groups that I belong to for the condition who end up having multiple surgeries for this condition. We're not talking 2 surgeries, we're talking 7 or 8 surgeries. And
Wow.
that's when you have to kind of take a step back and be like, why is this? Because, I mean, really, there is no cure for endometriosis. It can be better managed. But if you're having to have all of these surgeries for one condition, we need to take a step back and think, okay, what could possibly be driving this process that this patient has to keep having all of these surgeries? And there are a multitude of causes. And I think that's where we kind of fail in the healthcare community, is really taking a step back and thinking, okay, what can we do to see what could possibly be driving this process in this individual? Because there are tests available. There's some great podcasts out there. I know Dr. Mark Hyman has one that I actually reference in my article.
So, I know you can't speak on behalf of your medical team, but can you speculate maybe on some reasons why the medical community sometimes overlooks this diagnosis?
Yeah, I think oftentimes it's overlooked as it's just part of your menstrual cycle, or it's just part of being a woman and it's supposed to be accepted as something normal, but it's not normal to have these, painful menstrual cycles or to have significant pain multiple times throughout the month. And a lot of these doctors, unfortunately, from other stories that I've read about or I've heard about, women have experienced this and they keep experiencing the same problem. And we have to get to a point where we realize that this isn't something we can't make normal anymore. We shouldn't be normalizing this. We need to really listen to the patient and get to the bottom is why these symptoms are present, because symptoms are a way of our body communicating to us that there's a problem. It's up to the doctor to work with the patient and try and figure out what that problem is.
Now, if patients find themselves in a situation where they feel like they're being gaslit, or they feel like the doctor is putting them through all these procedures without a clear path forward, just tell us some of the options patients have in these situations.
Yeah, so my doctor in particular, we started with a transvaginal ultrasound. And she said that's kind of where we're going to start. That's like our starting point. And then from there, we'll see what it might, tell us. It may not tell us anything. And from there, we might have to do additional testing. There are a lot of different testing methods. Sometimes it may take laparoscopic surgery in order to identify endometriosis. In my case, I was able to get diagnosed via transvaginal ultrasound in conjunction with an MRI. So the transvaginal ultrasound detected an endometria, which is a very specific type of cyst that is normally seen in conjunction to endometriosis. But to really support that or be more confident that that's what we were finding, we went ahead and did an MRI. And the MRI results were supportive of what was found in the transvaginal ultrasound.
Fine.
Some women will get CT scans. They might even get, scoped in different ways. And like I said, the laparoscopic surgery is what oftentimes some women will have to identify the condition.
In your article, you mentioned about the role of women's intuition when it comes to this diagnosis. So talk more about that.
Yeah. I would say women's intuition in general is something that most of us are blessed with. I've used my intuition in many circumstances throughout my entire life, my personal life, my health, work. But if you feel that something isn't right or you suspect something's not wrong, there's no reason why you can't really seek out what your body is trying to tell you. And it's not only with endometriosis that we might, feel this inner voice or this intuition that we have. And, even with me taking a step back when I had granulomatous mastitis, I knew that this disease just wasn't happening on its own. I knew there had to be something that was driving that disease process. And it might have been a monumental task to figure it out, but I did. And I listened to my intuition and did my research, and we finally got the answers that we needed. And I think that's important with anything that we're going through, even, with endometriosis. If you feel something's not right, if you feel something's wrong, there's no reason why you shouldn't seek out why that is. And I mean, your symptoms, are valid, right? They're there and they're real, but it's trying to convince your doctors to understand and respect the same thing that you're feeling.
So I know that you're an active member in various patient communities. Talk about some of the advice that you're reading in these communities. Take my audience into these communities, and what are these patient advocates talking amongst themselves when it comes to getting their healthcare clinicians to listen, or if their clinicians aren't listening to them, what they should do next. Talk about some of those discussions.
Yeah. So in a previous article, I talk about my A+ list to advocacy. So definitely check out what that is and the details that are around that. But sometimes what I'm really seeing in a lot of these support groups is a lot of the repetitive information. It's,
Hmm.
I've gone to my doctor, I've told them about all of these symptoms, all of these things that I'm feeling there that I'm seeing, and I just don't feel like I'm being heard. And it might be, well, you can try this birth control pill, or maybe you can change your diet a little bit, or maybe you could try this drug for, XYZ amount of time. And those are really band-aids. You know, why don't we try to figure out exactly why these symptoms are there instead of trying to band-aid the problem? And it's really frustration. Frustration would probably be the number one word that I would use when it comes to women in endometriosis or women in adenomyosis. That's often a kind of separate condition that's seen in conjunction to endometriosis. And there's a lot of women with PCOS that experience, these similar symptoms. And it's getting to the root causes. And I think that If we take a step back further and try to identify what is driving all of these symptoms, what is driving the disease process, that maybe we can kind of get ahead of things and maybe we can end up helping a lot more patients better manage the condition.
Now, speaking as a physician, there are sometimes cases, and not just endometriosis, but as you know, there are a variety of cases where physicians simply don't know or there is no clear path forward. And that may involve some cases of trial and error. Like you said, try this, see how it works or not, and come back in a few weeks and we could talk about next steps. So, in those situations where there is not a clear path forward, how do you advise us clinicians in terms of how to communicate that uncertainty with patients?
Yeah. If the uncertainty is there, as a clinician, what can the clinician do to help bring more certainty to the matter? It's a guessing game if you're just prescribing all of these different prescriptions. We need to find out why those symptoms are present. And the only way to find out why is to do testing. So if they aren't doing testing, that could potentially be a big problem because wouldn't you want to know exactly what the patient is dealing with before you try to prescribe all of these different drugs?
We're talking to Tami Burdick. She is a patient advocate. Her book is Diagnosis Detective, Curing Granulomatous Mastitis. Today's KevinMD article is Women's Intuition in Health and Healing. So, Tami, as always, as we come to the end, tell us some of your take-home messages to the KevinMD audience.
Yeah. Use your inner voice. If you feel something's wrong, if you feel something's not right, listen to your intuition and follow that and always be your best advocate. Being your best advocate is going to help you with everything in life, not just your health, but your career, your family, your friends.
Tami, thanks once again for sharing your perspective as a patient advocate. Thanks again for coming on the show and sharing your story and insight.